Would you like to introduce yourself shortly?
Well, I am a serial entrepreneur who's
Yeah.
been working in many different spaces for the last 25 years with digital solutions, but I would say probably for the last 12 to 15 years in healthcare, quite a lot.
Yeah. You've been you're a serial entrepreneur working in healthcare, but you also been experiencing challenges in healthcare that also put a lot of pressure on you and on your health. Tell us a little bit about the pressure that you experienced and what it has led to.
Yes, for sure. So I have this special moment that I wanted to share so people understand why you might start building things. So this is a number of years ago when I was at the time raising my second round for my healthcare startup that I had at the time. And I was working a lot. I came home late one night and I sat down at the kitchen table to have a little bit of food, and I put on the TV to look at the news. And I remember this so clearly because it was the finance minister at the time, Mikael Damberg, who was in an interview, on the screen.
Okay.
And all of a sudden, his face disappeared.
Oh.
I couldn't see his face any longer. So I turned to my husband and I say, is there something wrong with the TV? It turns out there is nothing wrong with the TV. So I ended up in neuroemergency care for 2 nights and 2 days. I had had a microstroke.
Oh.
And it's not shocking, actually, that I got this, that I had this symptom and that this happened to me. It's shocking that it had to happen. So the thing is that I was born with a rare genetic disease, and for years I had been telling healthcare that this can happen.
So you knew about your disease before
yes, I knew about the risk. I knew about the disease. I knew about the risk, and I knew about what are the values in my blood that we need to monitor. What are the ranges that are healthy for someone like me, and what are the kind of treatment plans that I need. But for years they got it wrong. Either they didn't listen, or they measured the wrong values, or they used the wrong reference, intervals for certain values. So no, I wasn't really helped. So I'm ending up sitting in a hospital bed, trying to raise money to fix healthcare for a different group of people with a different disease, while being failed by the health system myself. So that was a lot of pressure.
Yeah, a lot of pressure. And was it all because that pressure also kind of build the momentum for you to build something else that you're building right now?
Yeah.
I'm also curious, before we go into that, did you continue with the venture that you were working on, or you just shifted?
No, at the time there were several years that I worked with that solution. But eventually that story ended for me, and I could start thinking about what's next for me as an entrepreneur, and then going back to this situation and a lot of other situations, and also other patients and individuals that I've met over the years. So what helped me realize more vividly what I needed to build was that, so one of the major symptoms of my disease is severe nosebleed. And I'm talking about the kind of nosebleed that makes you handicapped in everyday situations. So 2 years ago I had surgery, and unfortunately that didn't help my situation. It got even worse. And about a year ago I was becoming desperate. I didn't know what to do. I just realized I can't live like this any longer, and another surgery might make it even worse. But then one day the nosebleed is gone, with maybe 80%. And I had no idea what has happened. But the thing is that for years and years, I've been feeding my lab results into AI, my symptoms, my treatments, a lot of information. So I knew exactly what to do. I went to AI and, tried to figure out the situation. What is happening, I asked. And AI came back with a response immediately with a clinical trial that I could trust. And the thing was that it was my hormone therapy that my gynecologist just had prescribed for completely different reasons. That was the solution. She didn't know that. The specialist on my disease never spoke about that. And the primary care physicians, they didn't know, I didn't know, but AI found out. And it changed my life. And I realized what needs to exist. What do we need to build?
Yeah, and that's what you're building right now. Maybe since you're in the middle of building it, you want to kind of tell us too much about it, but what can you tell us, and especially Because when you describe what you're describing, I'm here like, wow, that sounds amazing. But can we trust the AI? And like you're saying, you also were like, you were feeding it, but you chose to feed it. What also, to come back to the question, what is it that you're building now, and how can we make sure that we trust it and that we also kind of keep the integrity within the healthcare system for it?
Yeah, that's a great question. So, I mean, first of all, I think a human being and AI can do extraordinary things together, and my situation is a proof of that. But you know, to all the women out there who feel that the system is not listening to them, I mean, rely on what you're noticing, because that's real. And AI is not going to replace all the experts or the human being experts that are out there, but AI can become a really powerful partner. It can help you ask the right question to understand more about the situation, and it can help you walk into a room and be really prepared. So it's you know, a partnership. That's what it's about, to understand what is risk, what is not risk, etc.
Let's say for in your case, and that's why I'm also wondering about the solution, because you were really prepared, but the healthcare system wasn't prepared for your kind of empowered knowledge with AI. And I think the healthcare system has been struggling for a long time with like people knowing more, but they still feeling like we know more as experts. And how that's kind of a huge thing to overcome or to dance with. I don't know how to say.
Yeah, no, you're right. I think that's a major challenge. And what I've learned over the years is that it doesn't matter how much knowledge you have as an individual, you still need an ally on the inside, because that's where some of the decisions that are important are being made.
Yeah.
So if you want to use AI to improve the healthcare system, you cannot build around the individual or the patient alone, and you cannot build around the institution alone. You have to build something for both at the same time. So, I mean, that's what we're doing now in this group. We call
You're building something for both at the same time.
Yes, we do.
Wow, yeah.
So we call it a operating system for precision health. But, you know, try to put it simply, it's about the individual controls his or her own data.
Yeah.
And it's shared with AI and the clinician. And together they analyze this vast amount of information to try to figure out, you know, what are the symptoms that we need to measure and why. And together with the patient, you set the treatment plan. It's a collaborative process where you come up with a treatment plan and everyone understands it and why.
Yeah.
And I think and it's not about, you know, omitting the doctor.
No.
There is still the human in the loop.
Yeah.
And I think the reason for why a small team can do this today is because of AI. I mean, just, you know, 5 years ago, this would have costed millions and millions and millions of crowns or even dollars, and it would have taken a decade. But with AI, it's still very complex. It's not a walk in the park, but it's doable.
Yeah. Wow. Amazing. Okay. Maybe if we also like, I just need to ask, how is your health right now?
It's good.
It's good.
I started this morning with a little bit of nosebleed, but it's, you know, it's nothing like, you know, what it compared to. I'm fine, yes.
Yeah, and AI, it's still like, just feed AI, like how do you use AI to stay well?
Well, I mean, now that I'm starting to use our own system that we're building, I get so much knowledge and I get so much support and guidance for, you know, what to do in terms of treatments and lifestyle, etc. So I'm fine. Now I just, you know, want this to be, of course, spread eventually. But I think what I want to share with the audience is also that pressure from a system doesn't have to break you. It rather helps you see, you know, what needs to exist. So I think that kind of situation help you build new things. And also what I've learned is that in order to make AI powerful in healthcare, I don't think we should use it to just make an already broken system more efficient or faster. We should use it to build something completely new.
Wow, beautiful. Thank you so much.
Thank you.
Thank you. Such a powerful story. Thank you.
Thank you.